So welcome to our induction video. The purpose of this is to let some of you meet the team, understand a little about our induction process here in the Ulster, alongside helping you visualise the journey you could have in our induction bay. In most pregnancies, labour starts naturally between 37 and 42 weeks and is called spontaneous labour. Ideally, this is what we would all want, but sometimes you need a little help and you need to be admitted to our induction bay. Induction of labour is a process used to encourage labour to start, and in order for this to happen, the cervix, which is the neck of the womb, needs to shorten, soften and open. After the induction process, whether you've been able to go home, experience an outpatient induction or stay in hospital, you will then move on to our alongside home from home unit or our labour ward for delivery, depending on where is most suitable for you to deliver. We would also like to guide you in what you can do to help yourself go into labour yourself and labour spontaneously, and we would encourage early and frequent mobilisation. Try and stay off the bed as best you can, and also use our birthing balls, mats and potentially hydrotherapy in our pools or showers with our telemetry machines, and a pool like this one. Remaining mobile for as long as possible will always be recommended by us all. Prior to arriving in our induction labour bay, we'd encourage the uptake of a sweep. We also offer the option of attending our standalone midwifery-led unit in Lagan Valley if you're low risk, if you live near and go into labour during our outpatient induction process. We really do hope that your journey will be a positive one in our induction bay in the Ulster Hospital, or whether or not maybe you miss the induction bay and go into labour spontaneously. It's a positive place to be and the staff are great. To encourage all efforts to avoid being induced, one of our midwives is now going to chat to you about the subject of sweeps.
Hi, I'm Sandra Graham. I'm one of the midwives, part of the induction team, and I'm going to be talking about membrane sweep. So you'll be offered a membrane sweep by your community midwife or doctor who's arranging your induction date. Prior also to your induction date, you may be offered a second or third sweep in the community or the hospital. And this is to encourage you to go into spontaneous labour. A membrane sweep is a drug-free way of helping bring on labour. There's no guarantee it'll work, but it does help. The sweep involves an internal examination and it doesn't take long. Consent will begin prior to this, and a finger is placed inside the cervix and the examiner will make a sweeping circular or sweeping movement with their finger to separate the sac surrounding your baby from the cervix, and this in turn triggers the release of prostaglandins and so encourages labour. It may be a little uncomfortable and cause some light bleeding, heavy show or tightening of the womb, and there's no increased risk of infection. Your baby's heartbeat will be checked following the induction procedure. It is also very important that you remain relaxed, using breathing techniques and not stress about being overdue. Other ways to encourage spontaneous labour include reflexology, nipple stimulation and intercourse.
Once the joint decision has been made that you will be having an induction, you will be given a date to come in. If the maternity unit is very busy, your induction may be delayed by a day or two. The decision to do this will be discussed with the senior medical team. The night before, you will be contacted and given a time to come in. Useful items to pack include your hospital bag and a bag for the baby, a water bottle which you can fill at the water fountain, plenty of snacks, for example cereal bars, fruit and chocolate. Unfortunately, we don't have a fridge, and please do not bring nuts or food containing nuts. If you want a bit of home comfort, you can bring your own pillow in. If you're on medication, please bring it in, and if you're a diabetic, please bring your testing kit, insulin and needles.
When there's a space in delivery suite, you will be transferred there to have an artificial rupture of membranes, also known as having your waters broken. You may also need to have an intravenous hormone drip at this stage called oxytocin. This will help augment your labour. Please note that sometimes there can be a delay when moving to delivery suite. If it is very busy, during this time we will continue to monitor you and your baby. If you choose to stay on the ward during your induction, we encourage you to be active as possible. We will provide you with birthing balls and various forms of pain relief. If you live near the standalone unit, like in Valley, it may be deemed suitable for you to go there if you go into labour.
The induction bay is based on the second floor beside delivery suite. On arrival, before we start the induction of labour process, we check that it is still safe and appropriate to proceed. We will perform a short trace of your baby's heartbeat using a CTG machine, like this one. and then taking your temperature, your pulse and blood pressure. When we are happy to proceed, the midwife will perform an internal examination and insert either a ProPES or a balloon catheter. During this procedure, you can use gas and air if you feel uncomfortable. Following this, you may need to stay on your bed for 30 to 60 minutes, and during this time, you may be on the CTG machine. Afterwards, depending on your own personal circumstances, you may be able to go home for 24 hours, or you can stay in the induction of labour bay. If you choose to go home, you will be given several telephone numbers, so you will always have access to a midwife for advice. You will also be given information on when to contact the midwife and to return to the induction of labour ward. After 24 hours, if you're not already in labour, you return to the ward where your bed will have been kept.
And I'm going to briefly chat through our induction of labour options that are available to all women that come through the Ulster Hospital. The first option we have consists of the hormonal method, and that method is called ProPES. ProPES can be used in both an outpatient and an inpatient setting, should women meet a certain criteria, particularly for the outpatient setting. For ProPES to be used in an outpatient setting, it is more suitable for women who have what are deemed to be a low-risk pregnancy. ProPES works by being inserted into the vagina and placed just behind the neck of the womb, and over a 24-hour period slowly releases hormones that are very similar to those that the woman's own body produces in the early stages of labour. And during this period, the neck of the womb softens and dilates open, to a point that after or during the 24-hour period, the neck of the womb is open enough that we can then break your waters and then start the labour process. With regards to our other induction method, how this method works is similar to ProPES. A vaginal examination is required, and the silicone tube, the Foley catheter, is placed through the neck of the womb, and the tip is then placed between the inside of the neck of the womb and baby's head, and can stay in up to 24 hours. During that time, baby's head gently presses against the balloon, and it in turn moves down and dilates open the neck of the womb. It is a slow and controlled process and does not cause any anxiety or stress to mum or baby. The benefits of having the Foley catheter is that more women, particularly those that are deemed to be slightly more high risk pregnancies, are eligible to have this as an induction method in an outpatient setting. With regards to both ProPES and the Foley catheter, women come into hospital and they have a checklist performed to ensure that both mum and baby are happy at the beginning of the induction process. Tracing of baby's heart is performed to ensure that baby is happy, and then after chatting to the midwife, the mum then chooses the best option for her, and if suitable, regarding whichever method the mum chooses, it is then decided whether mum is better to have the induction in an inpatient setting or as an outpatient. After the tracing of baby's heart, the method of induction chosen is then placed, should it be ProPES or the Foley catheter. As an inpatient, having had the ProPES inserted, baby's heart rate is then checked on a 4-hourly basis during her time in the hospital. If a Foley catheter is placed and mum remains in hospital, baby's heart rate is also listened into on a 4-hourly basis whilst mum is in hospital. With regards to induction of labour as an outpatient, the mums are given a time to come back within a 24-hour period, unless either induction method falls out by themselves or the mums feel that they need to come in a little bit earlier to be reviewed. In an outpatient setting, regardless of whether using ProPES or Foley catheter, mums are able to complete the induction process in the comfort and confines of their own home.